The Life After Baby Postpartum Depression Workshop. So, you've given birth, and what an experience that is. Many mamas feel overwhelmed with emotions when they give birth to their babies. These can be both happy and anxious emotions. I remember that when I had my baby, that I was so excited and happy, yet so scared of the thought of being responsible for taking care of this little human, that she was depending on me. Having a hard labor and delivery can contribute to postpartum depression. However, having a positive birth experience does not mean that there's not a chance of getting postpartum depression later on. Before we start talking about postpartum depression, I think it's good to clarify what are the baby blues and what's the difference between postpartum depression. So, baby blues are feeling sad, tired, anxious, overwhelmed, or not connecting with your baby. These feelings, however, last less than 2 weeks, and they are due to changing hormones. When you get pregnant, your hormones change, and you have so many emotions and irrational actions that we sometimes take because of these emotions. And when you give birth to your baby, your hormones are kind of changing back to normal, and that also causes some of these overwhelming emotions. A few of the things that you can do with baby blues are sleep when baby sleeps, ask for help, and talk to someone. And these will help you to kind of get through these 2 weeks. However, if some of these feelings last more than 2 weeks, you might have postpartum depression. Postpartum depression are those feelings, also feelings of sad or feeling worthless, loss of interest or satisfaction in doing things, overwhelming anxiety, overwhelming exhaustion, having a hard time getting out of bed, or finding it almost impossible to take care of your baby or take care of yourself, feeling angry or frustrated all the time, or the thoughts of hurting yourself and your baby. And if you have these thoughts of hurting yourself or hurting your baby, put your baby in a safe place, put them in their crib or just somewhere that is safe for them. Even if they're crying, I want you to leave them and go call your healthcare provider. Call your OBGYN or the pediatrician or your hospital hospital and talk to them. Make sure your baby's okay, but you want to make sure that you're okay, and they will be able to help you. This is a serious symptom of postpartum depression or postpartum psychosis. According to the Office of Women's Health, found on the womenshealth.gov website, postpartum depression is a serious mental illness that involves the brain and affects your behavior and physical health. If you have depression, sad, flat, or empty feelings that don't go away and can interfere with your day-to-day life, you might feel unconnected to your baby, as if you are not the baby's mother, or you might not love or care for the baby. These feelings can be mild to severe. So who can experience postpartum depression? Women, of course, and that's who we're focusing on today, but also men and your partners can experience postpartum depression, although they have not given birth to the baby. If they're involved in raising the baby at all, their life has changed. They are more responsible for a little human that relies on them, and their lives and the things that they can do can change. However, focusing more on the women, there are a number of things that increase the likelihood of someone experiencing postpartum depression after they've given birth. One of these things is race and ethnicity. Racial minorities are at a greater risk. Minority groups such as Hispanics and non-Hispanic Black women are at greater risk. women here in Utah in general, white, black, Hispanic, Asian, all ethnicities, the risk of postpartum depression is about 1 in 10 women. However, with black and Hispanic minority groups, it is more like 1 in 7 or 1 in 8 women who are at risk for postpartum depression. Marital problems, being divorced, separated, fighting with your spouse, all these can contribute to postpartum depression, as well as being single, or your spouse not involved in raising the child, and being alone in this situation. Another thing that can increase risk of postpartum depression are financial issues, stress about how to get money, or a loss of a job and income, or even changing from working outside the home to having to either quit, reduce your hours, or work from home. I switched from being working outside the home full time to working outside of the home only once or twice a week, and that was a huge change. It had a big change on my mental health because I wasn't able to talk and interact with other people as frequently. However, if you are concerned about having enough money to pay for either hospital bills or just the necessities that you need, we will be showing you at the end of the presentation a few of the resources that are here available in Utah. Another thing can be big life changes such as death of a loved one, divorce, moving, sickness, or complicated birth. Whether that was labor and delivery that was hard, or your baby has ended up in the NICU after birth, or you have lost your baby. All these things contribute to postpartum depression. There's also unplanned or unwanted pregnancies, as well as current use or previous use of drugs, and especially illegal drugs. So what can you do? You are not alone. You can overcome this postpartum depression, but it does take talking to someone. Talk to your spouse, your partner, a close friend or trusted family member, and talk to your doctor, your healthcare provider, and join a child-friendly postpartum depression support group. And you can find more. You can go to several different websites or even Google search postpartum depression, and they say that just learning about postpartum depression before you have your baby decreases the risk of having postpartum depression or experiencing these feelings. So it's something that you should learn more about. It's something that we should share with people. Let them know that this is a thing. The big question, why? Why should you find help? There are several reasons, several wonderful reasons, such as you will feel more like yourself. You will be able to take care of your baby better. You will be able to bond with your baby better. Your baby will be more likely to learn and hit milestones at the appropriate ages, and you will feel more capable of managing your emotions. And most importantly, you will not feel alone because you are not alone. I encourage you to take a look at these resources. These are just a few of the several resources that are available here in Utah. Wonderful programs that help mothers who either need food or insurance resources, as well as parenting resources like Welcome Baby. And help me grow. I've really enjoyed Welcome Baby. They come to your home and to make sure that your baby's hitting the milestones, and they just someone to talk to, which can also help you not feel so alone, as well as bring you gifts like diapers and blankets and formula and different things that you may need. Thank you for listening to this presentation.